Mental health services in the UK are under strain, with 1 in 4 adults experiencing mental health issues. Waiting lists are long. But a growing movement is offering a new approach. Green Social Prescribing, connecting people with nature and community, is showing real results. Improved wellbeing, reduced demand on services, and a strong social return. According to an independent evaluation of cross-government pilots, Green Social Prescribing costs £500, half that of a typical 10-session counselling course, yet delivers comparable or a higher wellbeing impact. The NatureMind Summit 2025 brought people together who are leading this change to ask the question, how do we scale up what we know works?
So we know from evidence of green social prescribing, we know that social prescribing, which obviously is lots of other things like cooking and singing and doing lots of work in communities, that has a real big impact on the NHS utilisation. So GP appointments goes down, A&E appointments go down. We also know that green social prescribing adds more. So particularly for mental health, it actually reduces some of the ONS4, which is the well-being of anxiety. Happiness goes up, anxiety goes down. And we also know that it creates connections as well with people, and particularly those people most vulnerable. Somehow nature really helps those people to feel safe, and they feel valued, and they feel they belong.
There are quite a few barriers that exist already to scaling up social prescribing. One of the main barriers is actually finance. So for our community groups, community colleagues like Mind Over Mountains and many other community groups delivering on this agenda, fundamentally they need finance, but the way that social prescribing is created, funding actually stops at GP surgeries. So commissioners need to recognise actually by sending so many referrals through out into the community, funding needs to follow through, because that's where the NHS, that's where social care, that's where many other sectors are sending people. They are sending them into the community, they are sending them into green spaces to benefit from nature connection, from nature exposure, from adventure, from all these wonderful things. But this is not free. The community groups, they are struggling, they need funding, they need resourcing, they need that support, that recognition that they are delivering a natural health service.
For me, there's two main barriers to scaling up effective models for social prescribing. The first model is sustainable funding for nature-based providers to be able to deliver the activities on an ongoing basis and reach a wider range of people. And I think the second barrier is in relation to evidence. I don't think we need more evidence. I think we need more targeted evidence about what works for whom in specific contexts. But we also need to raise awareness about how good the evidence already is, so that those decision makers can use the evidence to make decisions in an informed way and have the confidence they're investing in things that are going to work.
To be able to break down these access barriers, and this is just speaking from experience of recognizing that collaboration and partnership is really, really important. It's really important that these conversations are had with the right people to be able to effect the most change. It's not to be done to, it's to be done with. So we can ask questions, but for this to be effective, we need to incorporate the communities that we are trying to serve, hear their voices, listen to what their barriers are. We've got our ideas and we understand them to some degree, but getting the voices of those who we are trying to serve is going to be really helpful to being able to break this down in the best way.
There's two main ones that I think is very relevant for a GP. One is education, so actually providing GPs with a real understanding of the benefits. It's not something that gets taught in medical school, and there's not a clear pathway of mechanism of how things work. So I think there's work to be done there. So a lot of great work has been done, but it needs to get dispersed as well. The second part is, I think, effective and consistent referral pathways, so that GPs can be confident to be able to get the right people to the right places and know that they're going to be safe and the right kind of thing for their patients.
But on the ground, I would like, in some ways, for adults who come into a counselling service to not show up because they're getting offered other opportunities that better meet their needs. And it doesn't have to be that me working therapeutically thinks that what I offer is the best thing, that actually they get choice and that choice meets their need. And also that I can provide pathways for referral in a really easy system. And also that patients, clients, individuals are really informed about what they can expect. They're really informed about kind of the limitations and the parameters of that. And also they've got kind of general ethical frameworks in place. So for me, it's around how we offer more informed services that are more accessible, and actually they're integrated across all different stakeholders.
I think one of the challenges is convincing not just clinicians but the public that actually nature is another alternative to supporting well-being. I think the evidence needs to be stronger though, in terms of we have feedback saying this has saved my life, this is brilliant, but actually we need that high experimental evidence as well, so the randomised control trials that actually influence policymakers and commissioners' decision making to say not only does this work, but how confident that it would work for everybody. So we kind of need that mix of evidence to help convince commissioners, clinicians, and also patients that this just isn't people saying this is brilliant. Actually, we've got the science behind it as well.
There's a couple of things. One is the relevance of nature to people's lives. I'd say there's 2/3 of the population, whichever stats you look at, where nature is just not relevant. It's not at the forefront of people's minds. They might have other challenges in their lives.
Yeah, I think we can embed green social prescribing more deeply, really through innovation. What we're learning today is that there are no magic bullets. There's no kind of massive money tree that we can go and kind of pick the fruits from. And we've got to be creative, and that means different organisations, whether it's charities, corporates, the NHS, local authorities, all sorts of different actors working together in partnership and collaboration.
When patients go back to their doctor, their GP, and say, that green social prescribing, that work was amazing, it's completely changed. And the GP can then see, well, their blood pressure's dropped, we've got all these other things that have changed. And if that happens right throughout the country, we have 1 million appointments a day, we know that if that is happening all the time, then GPs and professionals will start to work. So I think it has to be from the ground up, and communities as well working. We've also got to collect the evidence and keep the evidence going.
I think the only way to embed social prescribing more deeply into health and social care systems is through relationships, and that's embedding relationships all the way through the pathway. So it starts with a really strong relationship between the participant who engages in nature-based activity and the nature-based provider or practitioner. Then those nature-based providers need to have really strong relationships with different parts of the health system so that referrals can come through and people can find their way to those activities.
I think there's 5 things. The first is to ensure that we embed it in key government policies and strategies across government, and that we continue to advocate all of its benefits to key decision makers and funders. Secondly, that we build those strong cross-sectoral networks between health and nature, and they can share knowledge and ideas. That we standardise data collection so we can tell a more powerful story. So build capacity in the health and nature workforces as well through training and other means. And then finally, and most importantly, make sure there's equitable access to green social prescribing so it's a truly universal offer.
Partnership, partnership, partnership. I think there's a real growth now, certainly over the past 5 or 6 years even, where organisations are starting to realise the impact and power of nature, getting people to see that it's a service that could be embedded so that it becomes business as usual. There's examples where we've got allotments attached to primary care hubs. Why aren't they joining the dots here and going, okay, we're using this space, how can we work with each other to say, okay, we'll work with your patients, can we bring nature in and you bring people out? What are the funding models to support that? I think it all comes down to the partnership and being aware of the impact of nature and the fact that it works alongside medicine, not to replace it.
So when they talk about key priorities for government being switching from hospital to community, switching from disease to prevention and from analogue to digital, there's a big piece in there to say actually a big part of that support in the community is enabling people to access nature, to be able to get the healing support of being with others in green environments. And we've seen lots of evidence growing about how impactful this is. It feels like integrated neighbourhood teams are a real vehicle where we can hardwire access to green social prescribing, whether they're formal initiatives or enabling people to get out in nature, or within community groups that are tackling social isolation. Those are fantastic opportunities on a real neighbourhood basis to make a difference, and the neighbourhood integrated teams are a vehicle for making that happen.
People come to us with very complex backgrounds and situations that have affected their mental health and well-being, or they're on a long-term health journey, and they come not really knowing what to expect. We offer them a very gentle kind of introduction to coming out in nature, and by the end of it, we see these people whose lives have changed. They didn't expect to find something that was so life-changing, but then they suddenly want to feel ready to go and find employment, or they feel ready to take the next step, or they want to come and be volunteers with us, or, you know, it's those, and it may be a smaller change, but yeah, those are the stories.
Grassroots community groups are enabling people from particular backgrounds and communities to access green spaces much more than I've seen in the past.
Awareness raising is probably key, and making sure that the information you've got is provided in multiple formats, multiple languages, and where possible in collaboration with the communities that you're actually trying to speak to.
It's all good organisations saying that they are trying to reach harder to reach communities, but if they're not actually on the ground within those communities, building connections and actively sharing the information and the education, then that gap is always going to exist. So I think organisations should have a duty to connect more within those communities, provide education, information and resources to allow people to know what's going on and to help enable them to access these green spaces.
Green social prescribing isn't what you might call a fringe part of the scene, more something that's a mainstay. It's a go-to rather than something you might consider secondary.
We have evidence. We have evidence that it is working. So I would like to build an advocacy around that for the policymakers, that they should facilitate, make more funding for it available, so that anybody and everybody can get hold of it, and rather than spending on medicines, prevention is better than cure. So I would say yes, put more funding to it.
A moment for me where green social prescribing made a real impact was actually on me personally. When I was struggling with PTSD, I became part of a horticulture project called Growing Well, and it gave me an opportunity to actually overcome some of my fears, to get out into the outdoors, an environment where there was no pressure for me to talk, but it was still okay for me to talk. To do that somewhere outdoors where exposed to the elements and nature's seasons, and to enjoy the days when it was tipping it down with rain as much as the days when it was beautifully sunny outside and we were harvesting the crops, just gave me an opportunity to come out of my own head and to get out into nature.
How commissioners can be encouraged to back social prescribing. They need to understand what the community organisations are delivering. So I would encourage commissioners, I'd encourage stakeholders to actually go out into the community and visit these community groups, be a part of the group, understand the benefits to their own health and well-being, because I think that there's a criticality if you don't understand what nature connection is, and you don't understand nature exposure, and you don't understand adventure and what it actually does to yourself or your family, your friends. It's hard to relate to it in a personal context. When you apply that then to the fantastic work that is being done out in the community, what we need to see is that system level support.
It's going to need, I think, some of the other areas of the health system to be shown to not be as effective as it might be. And then there'll be a realisation of needing to do something different. And I think with Green Social Prescribing, it is cost effective, it's got added benefits of environmental sustainability pieces as well. And I think the more the evidence base builds and the realisation that the system as we have isn't working as well, the two together, I hope, will make that difference and allow that shift for commissioners to actually go, there is another way.
What we actually need them to do is get out and understand really what it means to people, but what's at risk if this stuff disappears. It's a partner, it's absolutely fundamental to people's lives.
When it comes to backing green social prescribing long term, we need to think about different mechanisms for how people access it and how it's funded. And one of the things that is within the comprehensive model of personalised care, which has been NHS policy since 2019, and obviously personalisation in social care has been going on for a lot longer than that, are personal budgets or integrated budgets. And they've always struck me as a real opportunity to effectively micro-commission individual support focused on what matters to them and what really appeals to them. And of course, that's then a perfect opportunity for people to access green social prescribing of a type that really is going to meet their needs, to inspire them, to motivate them. And in that way, we can really see how you could create a funding flow that would work long term.
I think it's really important that commissioners and funders are encouraged to back green social prescribing now. We know the evidence base is there, and it's really now about creativity, about innovation, about open minds, and a real sense of ambition for change, and I think that's coming. What excites me most about green social prescribing at the moment in the UK is I think it feels like we're reaching a real tipping point. We're getting some alignment between what governments are trying to achieve and different actors around the country, charities, corporates, all sorts of other organisations that are really coming together and beginning to work together to deliver nature-based therapies.
It's the evidence. We know it works. It's cost effective and it proves health and well-being outcomes for participants, as well as increasing social connection and nature connection.
The medicinal values which scientists are very excited about now, and I think this future innovation is what is needed to carry on into the, certainly through this decade and into the next.
Success in green social prescribing in 5 to 10 years for us would be that systemic funded initiative, that real system level understanding right from commissioners through to people who may benefit from green social prescribing, that they can get it on prescription, that it's paid for, so there's no financial barriers. Some people face significant barriers to their health and well-being. One of them can be the simple thing of transport, so they could be signposted to a community group but not be able to afford to get to the community group. And if there was that understanding that as part of the prescription that individual may need transport funding, we just need to get a lot closer to really challenging the health inequities and inequalities that people are facing and really break down more barriers. So I think the future vision would be access for all.
I'd like to see a stronger emphasis in terms of access for children and young people into pathways of green social prescribing. And that's because much of social prescribing and access to nature-based activities is predominantly focused on the role of well-being for adults. What we understand is that inequalities in adulthood start in childhood. So if we can better develop the relationship between leisure, education, health and understand that as an integrated approach in terms of responding to the real needs that children and young people face. So if we think about adverse childhood experiences and think about how we buffer some of the challenging responses and contextual issues to that, then actually what we can see is a stronger, more informed response that can extend the reach of green social prescribing.
Now, when we think about green social prescribing, we're creating another avenue to be able to help people, their mental, their physical and their social well-being. And we're able to do it in a culturally sensitive way, which makes people feel more open to being able to share, to be able to connect and to be able to heal themselves in non-traditional ways. And I think going forward, and we're really hoping that in the next 5 years that we'll be seeing that the healthcare system does incorporate nature into it for its healing benefits for the community and to help people in alternative ways.
Rider, I'd like green social prescribing to be embedded within all 42 health and social care systems in England, and that we have the accompanying long-term sustainable funding to enable provision of those GSP activities, which in turn means more people can benefit, which hits key government commitments that more people can access nature, and that we shift to a preventative healthcare model.
I would love to be able to see a patient coming in to see their GP and be prescribed a nature therapy course as opposed to consideration of being on medication or talking therapies. You've got a third option. People can go to nature, and that's an understood thing. GPs are quite happy with it, the pathways are there. All of the green social prescribing providers around understand that mechanism, and then they'll get commissioned and supported in the whole process. So you've got actually an entirely new sort of modality of treatment that GPs and patients can really benefit from.
Seeing a range of communities, ethnicities, sexualities, just a diverse range of people amongst all green spaces, people from particular backgrounds that don't feel like these spaces are for them to feel like they belong.
To make that happen in practice, I think we need to make sure that we're hardwiring in the kind of roles and support within integrated neighbourhood teams. So they don't just become about integrating healthcare professionals and maybe someone from the social care team, but actually looking at everyone who is making a difference to people's health and well-being in a neighbourhood and creating that real multi-agency, multidisciplinary team of which green social prescribing is a vital part.
This is worth doing. People believe in it, people want it. I think there is a growing number of health providers seeing the difference. So what excites me is seeing it develop more, seeing other people open their eyes and get to this opportunity.
I think use nature and entwine it with everything else we're doing as social prescribing. It's not another package on the outside and you either bring it in or you don't. You make sure it's part of the entire social prescribing, and it will help add probably another group of people who we may not have captured before. So bring nature into social prescribing.
Green social prescribing is at a key turning point in the UK, with policy direction, funding and evidence all pointing in the same direction. There's a clear opportunity now to embed green social prescribing into the health and social care system. NatureMind 2025 brought together all of the people who are working across this area to see how we can actually scale that up in a real day-to-day practical way. Green social prescribing really does impact people's lives and their health. It improves well-being and also delivers a strong social return. What's needed now is action, embedding it into healthcare policy across the country. Success means that nature-based support is no longer the exception, but the mainstay of treatment and intervention for patients and people who may need that resource. We know it works, now it's time to make it routine and to make that change happen as fast as we can.